Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.
And hello again, everyone, and thanks very much for being with us. If the COVID-19 trend line in Arkansas continues to decline, the danger the virus continues to pose here as elsewhere remains. How to mitigate that danger when political support is dissipating. We'll update the clinical situation with a couple of Arkansas doctors who've been on the front line from the start. But first, the General Assembly. The legislative session that began almost 3 months ago likely will be remembered as one of the most conservative in generations. On guns, abortion, human sexuality, election law, the Republican majority has been on a roll and not always in sync with the Republican governor, and almost always completely out of sync with the Democratic minority. Joining us up top, Representative Robin Lundstrum of Elm Springs and Democrat Keith Ingram of West Memphis, the Senate Minority Leader. Ms. Lundstrum, let's begin with you. Some of the most controversial legislation of the session thus far has involved transgender individuals, particularly transgender youth. You have been an advocate for all of that legislation. It's been criticized as a solution in search of a problem. Your response to that?
Well, I would vehemently disagree. I think we need to see our children as something to protect. They're a treasure, all of our children. And I think it's extremely important when you talk about putting chemical sex change drugs into a child. That's a bad idea. What my bill actually proposes is just wait till they're 18. Provide all the health care that children need, but don't put a drug into a child that's, first of all, not intended for that, and protect children till they're 18. It's a pretty simple, actually, bill. It's very tightly crafted. Unfortunately, a couple of groups put out that I was cutting off all health care, which I thought was extremely cruel. We still have counseling in the bill, health care in the bill. It just says wait till you're 18 to make a big-time decision.
Our audio is a little bit garbled there, Ms. Lundstrom, so forgive me if I misinterpreted, but some of the groups that were in opposition included the clinical community, the medical community, including the pediatricians. Does that not speak, what does that say about the bill?
I think they've made it more political than anything else. Giving a child puberty blockers and cross-sex hormones right now is a very dangerous thing to do in adolescence. I think making that political is not a good idea. We need to take care of children first. The first thing of medicine is do no harm. All I'm asking is that we let children grow up. They do need to see their doctors, obviously. So they need to go to the doctor. They need to go to counseling. But giving them hormones that stop puberty and cross-sex hormones to a child, that's not a good idea.
So the pediatricians, for example, to cite one discipline, one specialty, they're politically motivated in their opposition?
I think this has gotten political. I've also heard from a lot of pediatricians and clinical psychiatrists that say, wait a second, in 10 years, we're going to be asking ourselves, where were the adults?
Senator Ingram, your response. You've been on the opposite side, on the south side of the Capitol.
Sure. I think that Representative Lundstrom said it exactly right. Where are the adults? And we're the adults. Why we would intervene between a parent and their child. Every major medical association opposes this bill. And we've made it political because it's been introduced. This has not been a problem until legislation such as this type has been introduced, and that's what's made it political, not listening to science and listening to doctors. Puberty blockers, it's been used for 50 or 60 years with no problem whatsoever for females that might be children that might be reaching puberty at 6 or 7 or 8 years old. That's a proven use of that drug. So puberty blockers are inherently have been proven to not be dangerous. But I think the biggest thing is, without a doubt, is the intervention between parents and their children. And our job as legislators are to protect the most vulnerable And I can tell you from the testimony, from the wonderful, eloquent testimony of Dr. Hutchison, who deals with gender issues here in Little Rock, these are vulnerable kids, and we need to be supporting them and their parents.
Senator, what about Ms. Lundstrum would argue, I suspect she would argue if she has not already, and some of your colleagues did argue on the floor, these are obviously life-changing decisions, and that someone under 18 is really in no position to make, has not reached the level of maturity, for example, that would be required of an individual to make such a momentous decision as that. Your response?
Well, I think that the delaying effect of puberty, the purpose is to allow someone that is 18 or older to make these decisions. As far as I know, there is not a single instance of any sex change operation going on in Arkansas. And I think the ancillary damage that could be done, I think that, and I know Representative Lundstrum has disagreed, but I believe Representative Deborah Ferguson is dead on in that that this bill, this legislation, that counseling services are considered health care and therefore medical services, and they're going to be, those would be prohibited under this bill.
Well, Ms. Lundstrom is, in fact, is a legislative majority in Arkansas. Are you practicing medicine?
No, sir. And first of all, the puberty blocker that he's referring to for a 4-year-old is not included in this bill. You need to read the bill. Second of all, puberty blockers and cross-sex hormones for a 14, 15, 16-year-old, this is new medicine. This is not even FDA approved. The United Kingdom just decided, no, we're not going to do this because this is not approved. This is experimentation on children. And second, we do interfere in a few things when it comes to parents. You can't take a child home from the hospital without a seatbelt. You can't give a child alcohol, cigarettes. You can't even buy cough syrup, or change your name, rent a hotel room, rent something. We do set some parameters to protect children. And I think experimenting on a child with cross-sex hormone and puberty blockers in puberty is a bad idea. And we are doing that now. We have not done surgery, but we have given puberty blockers and cross-sex hormones to children in Arkansas. And that's a bad idea at 14, 15, 16, especially when you look at cardiovascular disease, cerebral vascular disease. That's when they're doing bone density, bone growth. That's a big growing time for adolescents. And we don't even have a good grasp of all the things that are going on when you look at brain development. Kids are still growing. Brains are still developing. And when you give cross-sex hormones to a child at that age, you're interfering with brain development. So this isn't something to be taken lightly. I think you need to read the bill and look at the whole process here. We are interfering in a puberty and in growth process, and we need to not do that. And all I'm saying is let's press the pause button for just a second and let kids grow up and protect kids. They need to be taken care of.
I do want to move on to another issue, and that is the leadership in both chambers, the Republican leadership in both chambers, and Senator Ingram, we'll start with you, has introduced an alternate hate crimes. It's not called a hate crimes bill, but it's plainly a substitute for the bill that your colleague, Mr. Hendren, has introduced. Is that acceptable, do you think, in your chamber, or certainly into your caucus, the Democratic caucus?
We were made aware of the possibility of this legislation probably 3 weeks ago, I would guess. And as written, the caucus has declined to support it. We walk right up to the edge of a hate crime bill, but then we run away from the water when the tide comes in, apparently. It's not going to be recognized nationally as a hate crimes bill. So certainly the majority can pass it. But at this point, as it is written, I don't think there will be any Democratic support in the Senate.
Ms. Lundstrom, your caucus in the House would certainly seem to have the votes for it. Is the support there?
I don't know if the support will be there. It's going to be something we're going to have to sit down and read. We're just now seeing it. So it's hard to make an opinion or pass judgment on something that we've seen the bill filed yesterday at 1 o'clock. And so it's something that's going to be a must read this weekend. And I don't know. I'm not going to pass judgment on something that I haven't had a chance to thoroughly study.
Let me ask you this: should gay, lesbian Arkansans or transgender Arkansans, should they be a protected class under any kind of whether it's called hate crimes bill or the bill that Speaker Gillum and the pro tem has introduced?
I don't think anybody should be a protected class. We should have all Arkansans be treated equally and with respect. I think anybody that comes here needs to know they're going to be treated with respect, and that's the most important thing we can do as Arkansans, is treat everybody with equal justice for all.
Okay, and one other issue that I want to get to, and Senator, we'll begin with you. Plainly, there is some discontent. We've known this for some time with Dr. Romero as the Secretary of Health. He's acting secretary. Now, apparently, there are going to be some hearings, confirmation hearings. What's the status in your chamber?
Well, as you know, in rules yesterday, they requested the first time, I guess, that in my memory, that we will ever have a hearing on a gubernatorial appointee. I think it goes back to that the non-belief in science. I mean, I think they're wanting to try to question whether the mask mandate was needed. You know, did we take the steps to meet the pandemic or not? And I think that's the crux of the question. I first became aware of this a few weeks ago when I received a call from the governor's staffer asking if I would support Dr. Romero's reappointment. And it sort of caught me off guard when we were asked, because we sort of taken those things for granted in the Senate in the past to defer to the governor. But I suppose that's what this is about.
So, Ms. Lundstrum, over to you. It is a Senate confirmation vote, but can you give us a sense of the temperature towards Senator Dr. Romero in the House?
I think he is respected. I'm sure we're going to have disagreements on some things. That's just part of life in Little Rock. But I think he is respected as a very competent and well-educated man. And I've enjoyed my conversations with him. I think he's been helpful on a couple of my bills I've called him about, and he's provided some great information. So, but are you going to agree with everything? Probably not. But we'll wait and see.
Well, is there any reason in your mind, Ms. Lundstrum, that any justification, any reason why Dr. Romero should not be Secretary of Health?
I can't think of anything right now off the top of my head, no, but I'm going to wait and listen to the hearings and let the Senate confer. But I think the governor tries to choose the best people possible.
Ms. Lundstrum, Senator Ingram, thank you very much for being part of the program. Come back soon.
Thank you for having us.
Absolutely. Back now with our update on Arkansas and COVID and where from here. Returning to our program with our thanks, as always, Dr. Cam Patterson, Chancellor of the University of Arkansas for Medical Sciences, and Dr. Joe Thompson, CEO of the Arkansas Center for Health Improvement. Gentlemen, again, thanks for coming aboard. Dr. Thompson, let me start with you. The governor, of course, lifted his mask mandate effective April 1st. Your board wasted no time issuing a statement promptly, I think within 48 hours. Lifting of the mask mandate is not an all-clear signal. You want to pick it up from there?
Sure, Steve. I think we've never been in a pandemic like this, and so unwinding it, each next step is a new step and with uncharted risks. The COVID virus is still present in our state. We know that some of the variants have now emerged and are in our state. We know nationwide that the number of new cases is going up, not down. There are some hot spots, the upper Midwest, the East Coast, because of these variants. So just because the state has lifted a mask mandate, the guidelines are still in place that all individuals that are unvaccinated in large groups in the public space should continue to protect yourselves with masking, with distance, and with hygiene. The things that we have used to get us to this point of being able to start to relax a little bit. So it's not an all clear signal. Our board called for business leaders, community leaders, faith-based leaders, school boards to continue the mask mandates at the local level.
Dr. Patterson, Dr. Thompson just mentioned the variants. Now, regardless of one's immunization status, whether you receive the injections or not, How do these variants alter the equation, particularly those who have not been, for both groups, those who have and those who haven't been immunized?
Well, the variants are a concern, and the variants are a concern for a couple of reasons. One is that it may make a COVID-19 infection worse, that if you get infected, that you're more likely to require hospitalization, you're more likely to die from COVID-19. It may make it more likely that you could be infected in the first place, that it increases the probability that you will get an infection. And variants may make an individual resistant to the positive effects of the vaccine. The variants can do any of those three things. And the concern that we have right now is with the virus still so prevalent in our communities and with the variants making their way across the country, that in a state where we have only 30% of the population, even with a single dose of a vaccine, the risk that these variants will take over and potentially override the impact of vaccinations puts us at a very dicey moment in the pandemic.
A dicey moment. Well, the trend line seems to have been down in recent weeks. Yet there is clearly concern, continues to be clear concern in the clinical community about a fourth surge in this virus. Dr. Patterson?
Yeah, we remain concerned about that, and certainly variants would be a big driver of that. Keep in mind that where did these variants come from? These variants come from mutations in the viral sequence. Those mutations happen every time the virus replicates and is transmitted from one individual to another. So even if the rates of infection right now are down, the fact that the virus is still being transmitted in our communities means that the potential for more and potentially more dangerous variants persists. Until we get the rate of transmission low enough that the probability of new variants or rises goes down close to zero, we still remain at risk for additional COVID-19 surges.
Well, and both of you gentlemen continue to be concerned about, as Dr. Patterson just mentioned, Dr. Thompson will go to you, the comparatively low vaccination rate in Arkansas thus far. We have a lot more doses than we have arms or sleeves being rolled up.
We are making progress, and we are truly, as Dr. Patterson said, in a race to get our vaccination levels and protections up against the COVID virus that is going to continue to mutate and potentially develop more threatening strains. I would also caution, Steve, we saw the peaked increase at Thanksgiving, followed by the holidays, followed by New Year's as people interacted, and then we had that spike in January. We just had spring break last week, so I would anticipate the potential uptick over the next week or 10 days because we had more people traveling, more people interacting in a less protected way.
Both doctors, I had a physician friend relate the other day that his biggest concern regarding COVID now was COVID fatigue. People are simply weary of wearing masks. They're weary of social distancing. They want to go out, and they are lowering their guard. Dr. Patterson.
Yeah, that's a problem that we are seeing across our communities, and it's a real issue, which is why it's so important that we continue to speak in a unified fashion, as Dr. Thompson said, about the positive impact of masking, social distancing, and hygiene. We've got to stay on that message. And I'm concerned that as we back away from a mask mandate, that people will assume that it is safe, and it is not safe from a COVID-19 perspective in our communities in Arkansas right now.
Were you able to have your way? Would that mask mandate at the state level continue?
Steve, I think, go ahead, Cam.
Well, I'll say this. We have data that demonstrates that masking is beneficial, and we have data that demonstrates that masking mandates are beneficial. What we don't have data on is the right way to unwind this. And if it were me, I would say let's err on the side of being cautious and safe.
Dr. Thompson?
I would just add, I think the next 60 to 90 days are critical. If we can keep our defenses up while we get people vaccinated, we can break the back of transmission of this virus, and we can have a much more normal, enjoyable second part of the summer. If we lose our ground now, if we don't continue to be able to make advances to get that protection in place through the vaccine over the next couple of 3 months, we do have a risk. And therefore, my board called out for every decision maker, leader across the state to really try to stay in line, hold the line. Let's continue our masking, continue our efforts, and let's encourage everyone to take the vaccine when they're offered.
It continues to be a concern also. Well, let me go to this first, because I read from Dr. Thompson, one of your board members, passed along a clipping underscoring yet again the aggravated risk to a heightened risk to obese Arkansans, and we have an abundance of them.
We have used the Transparency Initiative's database, the All-Payer Claims Database of diagnoses, obesity, diabetes, COPD, heart disease, immunocompromised states, either because you have an arthritic issue or you're on chemotherapy. Probably more than half of our Arkansans are at high risk for bad outcomes if they get COVID. In addition, we're seeing that people who get COVID, about a third have long-term effects, brain fog, stamina issues, heart problems. This is not an infection you want to get. So we need to maintain our protections. We need to gain high levels of vaccination, and we need to work together because we're all dependent upon each other for our success.
And Dr. Patterson, your rooms, your wards are, have been anyway, crowded with individuals that with COVID who have comorbidities.
For sure, that's those are the individuals who get COVID-19 and become the sickest as a consequence of COVID-19. One concern that we have is that if we don't really stamp down the virus, if we go from this being a pandemic to this being endemic, meaning it's always around, always being transmitted at maybe a lower level than now, but is not really brought under control, then these viruses find the weakest individuals in our society, find people who have poor access to care, find people who have comorbidities, and they're going to be the ones who suffer. And those communities are going to be the ones who suffer, just as been the case with HIV, if this moves into an endemic status.
Are we moving into communities of color at the rate we should? Or are we showing improvement in penetrating communities of color with immunization?
Steve, I think there are efforts there, but we can never do enough. I mean, low-income communities, communities of color have been impacted the most by this virus, and they are also the ones who need the most assistance to get the vaccines. Many don't have transportation. They don't have the access or regular interactions with the clinical system. So we really do need all of our community leaders, faith-based leaders, clinical leaders to continue to try to take the vaccine into those communities, not make the individuals from those communities have to come to the vaccine.
Well, and the problem can be even more acute, Dr. Patterson, as I understand it from some of my reading, in rural portions of the state where access is even more limited than certainly than in urban areas.
Well, for sure. There are plenty of places in our state where it's a 45-minute drive just to the nearest pharmacy, much less to a full-service healthcare provider. And when we've taken on some of this challenge ourselves at UAMS, creating mobile vaccination units. Yesterday, we opened a clinic at the Simmons Center in collaboration with Arkansas Blue Cross Blue Shield in North Little Rock. But Dr. Thompson is absolutely right. We have to be active in going to these communities, especially because not only are they challenged from the perspective of access, but there's also potential distrust issue with the healthcare system that we have to overcome, especially in an issue like COVID-19, where frankly there's been so much disinformation. We've got to go above and beyond to get to every single Arkansan. We can't allow one of the 3 million Arkansans to fall through the cracks here.
And finally, to the politics of healthcare. Your colleague, your fellow physician, Dr. Romero, the acting Secretary of Health, there is some open political pushback against Dr. Romero. Dr. Thompson, let me start with you. should he be confirmed as Secretary of Health?
I think without question, Dr. Romero has been leading the state, advising the governor, safeguarding our Kansans, and should be confirmed. I think the important thing here, Steve, is this is a pandemic. This is a new viral threat to humanity that we have never experienced before, at least those of us that are less than 100 plus years old. And this is a threat. And with that threat, took actions that were not popular. And so it's not surprising that we have some political discourse. But I think as we move out of this, we need to learn what worked. We need to have dialogue and discussion so that when this happens again, and it will, that we have less division and we can act in a more unified way to avoid unnecessary deaths that unfortunately we experienced.
Dr. Patterson, with a few seconds remaining, I'll give them to you.
Dr. Romero has been the chief of pediatric infectious disease here at UAMS. He remains a faculty member. He's nationally recognized. I think he's the right person for that job, and we're lucky to have him there, and I hope that he gets Senate confirmation.
Dr. Patterson, Dr. Thompson, we're simply out of time, but we thank you, as always, for yours, and come back soon.
Thank you.
All right. And thank you, as always, for joining us. We'll see you next week.